So, Daniella, I wanted to let people know that when we spoke about the amazing experience that you've built up in Kenya and in the region, you have over 15 years of experience in the distribution value chain, the whole distribution value chain. And now as the CEO of the Kenyan Pharmaceutical Society, you are actively building capacity, human resource capacity, and institutional capacity. So I'd like you to perhaps share that experience with us and also tell us a little bit about what are some of the lessons you've learned in Kenya about the regulatory challenges that we have and how we can overcome that through the AfCFTA. Thank you.
One of the things that we must focus on, obviously, is increasing capacity for production within Africa to make our value chain more resilient. But it's not only about good manufacturing practices or increasing manufacturing. We have to recognize that the quality and the value of a medicine, it has to be factored in from factory to patient. And that's why I like to really focus on good distribution practices, strengthening the distribution value chain, maintaining integrity of medicines, having end-to-end quality assurance of the product. Because a product might come out of a very good factory, and depending on how it's handled, it will reach the patient in a way that it will not help the patient. Number two, the product may be very cheap from the factory, may be very affordable, but by the time it gets to the patient, if that process is very convoluted and has so many stages and it keeps changing hands, then it will reach the patient in a way that the patient cannot afford. And so we need to give equal importance to looking at the distribution of medicines, the quality assurance of it, and just making it a little bit more straightforward, reducing the iterations that are in the process. And in this regard, we need to look at having regional hubs, and that's an opportunity that I see the AfCFTA affords our countries, because we don't want Kenya to be importing their little consignment, from Europe, and then Uganda is importing their little consignment, and Ghana is importing. We can have regional hubs. We can have regional hubs in East Africa that import whatever we need to import, because we're still a long ways from dependence on import. So in the meantime, let us make our importation smart by having regional hubs of medicines that are probably in customs bonded warehouses. They're yet to be distributed to nearby countries, and this will reduce the cost because then we're importing in bulk, and then it's easier for us to manage the quality when they're in these huge regional hubs. So again, we should not just only focus on regional hubs of manufacturing, but we should look at regional hubs of distribution. And with a sort of borderless system, and with the issue of tariffs addressed by the AfCFTA, then movement of those products then becomes cheaper for our countries. And so the experience we certainly have in Kenya, we're still very import dependent. In terms of value, we import 70% of the medicines we consume in Kenya. In terms of the actual parts, in terms of the quantities, it's probably 50-50. And so we know the challenges of having to depend on importation. We know the challenges we've had with COVID, when we realized that the global supply chain is not resilient to a pandemic. And so in terms of regulatory harmonization, we feel that there's been a lot of harmonization efforts. we've talked about it for so long. The concepts are great on paper, but the implementation is not, does not match the ideas. And so some of these drugs that we need to import in small quantities per country, some of the license owners are not interested in registering, for instance, in Kenya, in Uganda, because the quantities are too small and the regulatory requirements are different and lengthy and difficult. And so harmonization will help us right now where we are, and will definitely still help when we move ahead to increasing our local capacity and we have more products manufactured locally. So I cannot stress enough how much of a barrier different regulatory regimes are in terms of access to quality medicines for our people. It's unfortunate that sometimes a hospital has to import its own product for its patient because the license owner of that product globally is just not interested in having that product licensed for that country. And so this is something I think the AfCFTA, as you look into implementing it, because, you know, in theory, our heads of states, you know, are aligned and they're in agreement. But in terms of implementing it, we really have to implement regulatory harmonization. We're not starting from scratch. The concepts are already there. The AU model law is already there. There's a little bit of baby steps in harmonization per region, certainly in the East Africa region. But we need to make it move much faster in order for us to benefit from this free trade area. And so I think I'll just conclude by saying, as we think about boosting African capacity to manufacture, let's also remember the services that support that capacity, and those are logistics, distribution, digitization of the supply chain for traceability, for visibility of what's moving to who, to where, and let us simplify that supply chain. Over back to you, Faisal.
Thank you. Thank you so much, Dr. Daniella Munene. That was really amazing, sharing your experiences.
You said my focus is distribution. I think one of the ways to implement this free trade area and the free trade agreement is to have sort of borderless movement of products, and to have regional hubs of pharmaceutical and health products warehouses with a centralized distribution system. And so we can divide the continent into logistically manageable chunks, where if each country needs a certain product from, say, Europe or India, then these products can be brought into the hub and then distributed into each of the countries, thereby saving cost and also being easier to trace batches and the quality through the system. And we should, you know, this free trade area, it gives us an opportunity to leverage on the strength of each country. So one country may be more advanced in a manufacturing hub, for example, Ethiopia, and the manufacturing hub and the bioequivalence center that I heard is being developed. So we don't need to replicate that in Kenya. But Kenya might be a little bit ahead in terms of logistic services. So let's build a distribution hub over there. In terms of API plant, let's identify, you know, maybe the country with a more advanced petrochemical industry, because we know that, you know, to make the solvents more accessible and cheaper, you need a vibrant petrochemical industry to. But the whole point is the free trade area, in its implementation, we need to look at the strengths of each country and not need to replicate that. And so I was saying we need to identify who's ahead, who's miles ahead in terms of formulations manufacturing, who's ahead in terms of API manufacturing, and that's where the petrochemical industry comes in. It makes it a little bit easier to start API manufacturing when you already have some of the solvents you need in place. Who is ways ahead in terms of logistics, you know, and then we build these regional hubs that feed on each other and build each other, and not replicate things in each and every country. If we have a bioequivalence lab center in Addis, we don't need one in Nairobi. But let's make communication and trade between the two much easier. So those are my closing remarks.
Thank you. Thank you so much, Daniella.